Hi, I'm Lindsay, a librarian here at Gwinnett County Public Library.
And I'm Lucy, one of the library's social work interns.
Taking care of your mind is just as important as taking care of your body, but there are a lot of misconceptions out there about mental health conditions and treatments.
In this program, we're going to give you the information you need to know about mental health and share resources you can find right here in Gwinnett.
So, what is mental health anyway? Simply put, it includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices.
There are a lot of factors that can affect our mental health. Experiences, especially those that are traumatic or stressful, have a big impact. The relationships that we have with others also play a part, but so does our biology. Everyone has a unique brain chemistry, genetic makeup, and family history that can affect their mental health.
So, our experiences and biology can cause mental health conditions, sometimes also called mental illnesses or disorders, that impact the way we think, feel, and act. These are more common than you might think, and it's very likely that you know someone who has experienced a mental health condition.
About 20%, or 1 in 5 adults in the U.S., experiences a mental illness every year. For 1 in 20, this illness is severe and has a significant impact on their ability to function. However, only 1 in 3 adults with a mental illness receives the treatment that they need. About 8 million adults actually have more than one mental health condition. These are known as co-occurring disorders. 18% of mental illness co-occurs with a substance use disorder like the abuse of or addiction to alcohol or drugs.
Mental illness doesn't just affect adults. About 1 in 6 youth from 6 to 17 is also affected by a mental health condition, just slightly less than the prevalence for adults. 1 out of every 10 experiences a major depressive episode. This is actually higher than the rate for adults. Unfortunately, even less youth than adults, less than 20%, get the treatment that they need. For about 50% of people with mental health conditions, they appear before the age of 14. For 75%, they begin before age 24. Oftentimes, even though the symptoms are present during childhood or adolescence, the diagnosis and treatment of a disorder doesn't occur until adulthood.
In a survey of Gwinnett County students, 12% of high schoolers and 11% of middle schoolers had considered suicide, and 5% had actually made an attempt. Some of the other issues impacting our community are excessive alcohol use, affecting 15% of Gwinnett residents, and access to mental health care. Gwinnett actually has less mental health providers per capita than the U.S. and Georgia averages, which could mean people have to travel farther or wait longer to receive treatment.
Something else that has had a huge impact on mental health, both here and around the world, is the COVID-19 pandemic. The CDC measured symptoms of depression and anxiety between April, shortly after the pandemic arrived, and December 2020, and reported a 6% increase in these symptoms. A survey in June of last year, several months into the pandemic, found that 40% of adults were struggling with their mental health or with substance use. These numbers were even higher among young adults, racial and ethnic minorities, essential workers, and unpaid caregivers. This is likely due to the increased stress and isolation experienced during this time.
So, a lot of people are struggling with their mental health, maybe more than you realized. But what exactly are they struggling with? Let's see what the most common mental disorders are.
By far, the most common type of mental health condition in the U.S. are anxiety disorders, impacting 18 to 19% of adults, followed by substance use disorders and major depression, which each affect about 8% of the population. Although they're not included on this graph, eating disorders affect somewhere between 5 and 10%. Post-traumatic stress disorder affects about 4% of adults, and bipolar disorder about 3%. Borderline personality disorder, obsessive-compulsive disorder, and schizophrenia each impact roughly 1% of the population. This is a lot of numbers to process, but it gives you an idea of how common each condition is. The conditions near the top of the graph affect the most people, so you are much more likely to encounter people with one of these conditions or experience one yourself.
Because everyone is different, they can experience mental health conditions in different ways. Symptoms can vary a lot from person to person, but we'll give a brief overview of some of the most common ones. So let's explore each of these conditions, starting with the most frequent.
This information is not intended for you to diagnose yourself. That has to be done by a medical or mental health professional. This will simply give you an idea of what it is like to experience one of these conditions. If you think you or someone you know may be impacted by one of these conditions, contact your healthcare provider or reach out to one of the partners listed in the description box below.
Anxiety disorders can include both emotional and physical symptoms. They might make you feel restless or tense, cause apprehension and dread, make your heart race or your body shake, upset your stomach, or cause you to have trouble sleeping. Some people experience chronic anxiety in a variety of situations, and this is known as generalized anxiety disorder. Others only have anxiety in specific circumstances, such as social anxiety disorder, which only affects people in situations where they have to socialize with others. People with panic disorder experience panic attacks, sudden intense feelings of terror and difficulty breathing, often triggered by a stressful situation. Phobias are specific fears that trigger intense anxiety when exposed to a certain object, place, or event. Some common phobias are acrophobia, the fear of heights, and claustrophobia, the fear of small spaces, but there are many others.
Substance use on its own is not always necessarily a disorder, but if using a substance negatively affects your mental or physical health, impairs your judgment, affects your ability to meet your responsibilities, or if you feel addicted to or dependent on the substance, those are criteria that indicate a substance use disorder. 15 million Americans have an alcohol use disorder, 2 million have an opioid use disorder, and 1 million have a methamphetamine use disorder. However, substance use disorders can involve many other types of drugs. These are just some of the more common ones.
Major depressive disorder, commonly referred to simply as depression, can cause many different symptoms, but some common ones are the loss of energy and interest in activities that you usually enjoy. It can also change your sleep or appetite, either increasing or decreasing either of these. People who are depressed might have trouble concentrating, have feelings of hopelessness, or even consider suicide. Depression can also cause physical aches and pains, along with mental symptoms.
While anxiety, substance use, and depression account for the majority of mental health conditions, these disorders are also relatively common. Post-traumatic stress disorder, or PTSD, is caused by a traumatic experience. Many people might associate it with military veterans who have experienced combat, but other traumatic events, such as assault or abuse, can cause it as well. People with PTSD might experience flashbacks to the trauma, avoidance of situations that trigger stress, symptoms of depression, trouble remembering the trauma, anger problems, and intense startle reactions to stress. Bipolar disorder is characterized by a dramatic shift in mood between states of depression and mania, a state of high energy that often includes impulsive behavior and risk-taking. People with eating disorders experience a preoccupation with their weight and the food that they eat. In anorexia, this leads to self-starvation, and in bulimia, a cycle of binging and purging.
Somewhat less common disorders include borderline personality disorder, or BPD. People with BPD have very intense emotional reactions and trouble regulating their emotions, and they often display impulsive or risky behaviors. People with obsessive-compulsive disorder, or OCD, experience repeated intrusive thoughts or obsessions and irrational urges to perform certain actions or compulsions. People with schizophrenia often experience hallucinations, where they see or hear things that other people do not. They may also display beliefs or thinking patterns that do not make sense to others. There are many other mental health conditions that are possible for a professional to diagnose, but most others are very rare.
There are a lot of myths about mental illness perpetuated by the media or by people who have not experienced it or do not fully understand its impact. So let's set a few things straight.
Many people believe that people with mental illnesses are dangerous or violent, but this is false. Only a very small number of violent acts, about 3 to 5%, are committed by people with a serious mental illness. In fact, people with a mental health condition are about 10 times more likely to be a victim of these acts than to commit them.
Another common myth about mental illness is that people can just snap out of it if they try hard enough. This is also false. Viewing mental illness as a personal weakness places blame on people who did not choose to have a mental health condition. These are real disorders that require treatment, just like physical ones.
Lastly, there is also a misconception that people cannot recover from mental illness. Luckily, this is false, and many people with mental health conditions receive the treatment that they need to feel better and are able to lead active and productive lives.
So, what does mental health treatment involve? Well, it depends on the situation. In some cases, it will include therapy or counseling, where a person discusses their condition with a professional trained to help them work through it. Therapy can be administered by a psychologist, therapist, counselor, or clinical social worker who is licensed in this practice. There are many different types of therapy, some for individuals and some conducted in groups, including families or couples. Other individuals may receive treatment in the form of medication. These medications can help rebalance the brain chemistry. These may be prescribed by psychiatrists, physicians, or nurse practitioners who are qualified to administer medicine. In some cases, a patient will be treated with both therapy and medication, depending on their needs. Healthcare providers work with their patients to find the best treatment for the individual, sometimes trying some that don't work as well before finding something that helps.
Not everyone who visits a mental health care provider has a mental illness. There are other situations that they might be able to help you with. If you are struggling to cope with stress, maintain a relationship, or deal with conflict, therapy might also be helpful for you.
If you're not sure where to find mental health care, there are a number of options available in Gwinnett. Let's find out about a few different organizations in our community that provide mental health care services.
First up, we'll hear from Chad Potts, Executive Director and Counselor at Freedom Path Counseling, a faith-based counseling provider located in Lawrenceville.
Hi, my name is Chad Potts, and I'm the Executive Director at Freedom Path Counseling in Lawrenceville, Georgia. Freedom Path Counseling is a not-for-profit counseling center that offers faith-based counseling services to adults, couples, teens, children, and families. We're driven by a single goal: to help our clients experience healing in their lives. We believe healing opens the door to freedom from destructive behaviors, victory over life's difficult circumstances, and the restoration of relationships. We exist to see transformation in the lives of hurting people. Through counseling, we join those struggling in the process of moving from frustration, anxiety, depression, and hopelessness to having a clear plan for creating a path characterized by inner joy and true peace. Currently, we're offering services in person, through video, or by phone. Regarding fees for our services, we operate on a sliding scale to ensure those in need get the help they seek. While we don't accept insurance, we are able to work out a solution to serve most people. Our methods of payment include cash, check, credit or debit cards, HSA cards, and PayPal. In addition, we're able to provide counseling services in Spanish for teen girls, adult women, and couples. If you're struggling, we'd love to help.
Thank you, Mr. Potts, for telling us all about Freedom Path Counseling. Next up, we'll talk to Amanda Strittmatter, the Program Manager at Navigate Recovery, an organization offering peer-based support for addiction recovery in Gwinnett.
Hi, my name is Amanda Strittmatter, and I'm a Program Manager at Navigate Recovery Gwinnett. At Navigate Recovery Gwinnett, we serve families and individuals impacted by addiction. We do family supports, we do individual supports. We are a peer-led organization, so we are all people in long-term recovery, and we are there to share hope and strength and experience. We are the hub in Gwinnett to connect our peers to other resources in the community, meaning if a peer is looking for a detox or family supports, or if they're looking for residential or outpatient, we are connectors in the community to what they're looking for next. We are located in Lawrenceville, the heart of Gwinnett. We are just around the corner from the Justice Center. We are on 52 Gwinnett Drive. We are right across the street from Central Gwinnett High School. So Navigate Recovery Gwinnett is nonprofit, and all of our services that we provide to individuals and their families are free to them. All they have to do is be willing to take them. At Navigate Recovery, we have Safe Harbor, and that's our addiction recovery support center. That is a center that you can walk into. We have individuals and families who walk in. They're looking maybe for support for the next step. We offer recovery coaching. We offer support groups. We offer those resources in the community that they may not know about, that we've vetted or we've learned about for them, and we try to connect them with that. And that's what we do at Safe Harbor. That's the physical space. Lifeline is our emergency department program, and with that program, what we do is we show up at the hospital if an individual has overdosed or is at a high risk, and would like to talk to somebody about recovery and what that might look like, and we show up within an hour and just have that conversation with them. And our newest initiative is our Lightway Wellness Center. That is a center for women. It's residential, it's long-term, and it serves women who are pregnant and postpartum women as well. If you or anyone you know are interested in services at Navigate Recovery Gwinnett, all you need to do is either walk in our office, which is at 52 Gwinnett Drive or Suite A. Again, we are right across the street from Central Gwinnett High School. Or you can call in, and our number is 678-743-1808, and someone will answer the call, and we can get you some information and maybe get you to come in and have a conversation with us.
Thank you, Ms. Stripmatter, for sharing information about Navigate Recovery. Now let's hear from Trevon McIntyre, a counselor at the Progress Place focusing on mental health care for adolescents throughout the metro Atlanta area.
I'm Trevon McIntyre, mental health counselor at the Progress Place, Inc. The Progress Place is a collaboration of mental health professionals and many other resources throughout the communities. And what we do is we counsel individuals throughout the community who have mental health diagnoses. We partner with many other resources throughout the community to be sure to offer all of the needs that these people need met. We are nationally accredited through the Joint Commission, founded in 2011. We recognize all of our clients' needs are unique, which is why we create treatment plans to accommodate each situation. Our services are delivered at home, group homes, schools, and our office. We service individuals 5 and up with all aspects of mental health needs, such as depression, anxiety, anger, and more. We're located in Tucker, Georgia, and we also have teams of therapists located in the greater metro Atlanta area. We also serve DeKalb, Cobb, and Fulton counties, and more. We take Medicaid and CMO insurances, which include but aren't limited to standard Medicaid, AmeriGroup, Peach State, and others. At the Progress Place, we offer IFE services, which is Intensive Family Interventions. That's the team that I'm a part of, where we have a group of individuals who are both licensed professionals and paraprofessionals who collaborate to see clients various times throughout the week. Another great thing about the Progress Place is we keep a Spanish interpreter on staff, and it helps us serve the communities of refugees that we serve in different counties. We also have a 3-year partnership with Gwinnett Task Force. We also have a relationship with PADV, Partners Against Domestic Violence, also located in Gwinnett County. The Progress Place is here to provide you with the resources you need to better manage your mental health needs.
Thank you, Mr. McIntyre, for that information about the Progress Place. Lastly, we'll hear from Jennifer Hibbard, the CEO of Viewpoint Health, which offers a variety of behavioral health services in multiple locations around Gwinnett.
Hello everyone, I am Jennifer Hibbard and I serve as the CEO for Viewpoint Health. Viewpoint Health is a community service board that serves Gwinnett, Rockdale, and Newton counties. You can kind of think of us as the public health for behavioral health. We serve individuals with mental health needs, substance abuse issues, as well as adults with developmental disabilities. We are charged as the safety net of care for the state of Georgia to provide services to those individuals who might be uninsured and have low income. So we provide the care that is necessary if there's nowhere else that they could be served. The services that we offer are comprehensive and evidence-based. In Gwinnett County, we have 3 outpatient clinics. One of them is in Lawrenceville, and then we have 2 in Norcross. One of the Norcross locations specializes in serving the Latino population. All of our staff there are 100% bilingual, and we focus on multicultural services. And those services are available to adults and children as well. The services that we offer include, at the outpatient clinics, include psychiatry services, individual therapy, group therapy, family therapy. We also have services that are specialized for children, which includes play therapy. So we can see kids that are really young as 4 or 5 years old. And our services right now are also all available via telehealth. And it's really easy to access our care. You can go online and check out myviewpointhealth.org. We've got one centralized number that you can call to schedule an appointment. And right now, all of those appointments can be provided virtually, either through the computer or through the telephone. We do have more services other than just outpatient services in Gwinnett County. We have community-based services, which are where we actually embed clinicians in a lot of community partners, such as the schools. We have clinicians in 13 different schools in Gwinnett County. We also have a clinician embedded with the sheriff's office and the jail, as well as at Gwinnett Tech, and in some of our other community partners like Rainbow Village and Inspire Outreach. So wherever there's a human servicing organization that potentially might be serving somebody that needs our care, we want to try to bring our clinicians to the people that need our care, as opposed to trying to have them come through our intake process. We want to try to make it as easy as possible, because so many people that need mental health treatment tend to struggle alone and don't know really where and how to go get those services. So we want to try to break down that barrier to provide those services to the individuals that are in need. We also have a crisis stabilization unit. So if somebody is in crisis, meaning they're having thoughts about harming themselves, we have a safe place where they can stay for a few days in a safe environment where they can see a psychiatrist and a nurse and a counselor and really stabilize that crisis in a safe way. We encourage you to check us out online at myviewpointhealth.org, or you could also call us directly at 678-209-2411, where one of our access team will be able to connect you directly to a therapist where you can have an assessment. We primarily serve individuals without insurance who are low income, but we also serve people with Medicaid, Medicare, and some private insurance. I hope that you take some time to reach out to us if you feel like you're in need. We're here to help.
Thank you, Ms. Hibbard, for telling us about Viewpoint Health. Thank you again to all of our partners for taking the time to share with us and for the work that they do in our community. Some great additional resources to help you find mental health care are the Gwinnett Helpline, which can connect you to all kinds of services in Gwinnett County, and the Georgia Crisis and Access Line, which is available 24/7 to respond to mental health crises. These are great numbers to have on hand in case you find someone who needs them, and they're listed in the description box below. Another great resource you might not know about are the library's social work interns. Let's hear directly from Lucy to tell you all about this service.
My name is Lucy, and I am the social work intern at the Gwinnett County Public Library Lawrenceville branch. If you are looking for more social services in our community, the library is currently home to 2 social work interns at both the Lawrenceville and Norcross branches who would be thrilled to assist you. However, due to the public health situation, we may only be available through virtual appointments, which may be made using the Book a Librarian function on our website at gwinnettpl.org. You may also call our customer contact line at 770-978-5154 to speak to myself or the intern at Norcross and make an appointment.
Thank you so much for joining us for this program. If you would like to reach out to any of the community partners featured in this program, you can find their information in the description box below.
As always, the library is here to serve you. You can reach us through our website at gwinnettpl.org or our customer contact line at 770-978-5154.